So pembrolizumab and other PD-L1 inhibitors have been tested in patients who have triple-negative breast cancer and have shown low but durable responses. And this has been a very exciting area in the treatment of triple-negative breast cancer. We did an arm of a basket trial testing pembrolizumab, the PD-1 inhibitor, as a single agent in multiple different diseases. The basket trial looked at all different solid tumors to try and assess a signal of response after a sort of a phase 1b expansion. One of those arms were patients who had metastatic hormone receptor positive HER2 negative breast cancer, and those patients had tumor tested for PD-L1 expression, and only those with any evidence of PD-L1 expression were eligible. We know that that's a minority of patients with ER-positive disease, but we were able to find a substantial number of patients in this screening trial. So we enrolled 25 patients in the study, of which 22 had evaluable results, in other words, had at least one follow-up scan after treatment. And interestingly, we saw both responders and patients who had clinical benefit, so the combination of response and those who had stable disease for at least 24 weeks. Although the response rates overall were low, they still were quite intriguing because they were durable, similar to what was seen with triple-negative breast cancer. So it looks as though the responses exist. It's a smaller percentage of patients than those with triple-negative breast cancer, but these responses are durable. And the clinical benefit rate of 24 weeks adds into that, so that we had over a 20% clinical benefit rate, including partial responses in those who had stable disease for at least 6 months. Drug is very well tolerated, so of course the next step is to try and combine pembrolizumab with other agents that might either enhance the immune activation in hormone receptor positive disease, or that where their treatment might be enhanced, their anti-tumor effect might be enhanced by the addition of the checkpoint inhibitor. And that's going to require quite a bit of discussion and certainly brainstorming to figure out the right way to test this. There are already investigator-initiated trials going on testing pembrolizumab in combination with various agents in hormone receptor positive disease. Interestingly, there was data presented at San Antonio from another PD-L1 inhibitor, avelumab, and they showed a very low response rate, even in ER-positive disease and triple-negative breast cancer. So it may be that the agent makes a difference, the antibody testing for PD-L1 expression may make a difference, and it's possible that the dose and schedule of that drug is not optimal.